Hi, my name is Jennifer Holzer, and I'm a student at Columbia Basin College in the Bachelor's of Nursing program. I'm currently an RN and I work at a busy hospital locally, and I created a project based on something that we see at the hospital all the time. We have a lot of people that come in who've had a cardiac arrest outside of the hospital and require resuscitation. Recently, the guidelines for CPR changed from the American Heart Association in 2015, and I asked myself why the change, and has the change been helpful, and which is better, conventional CPR or the new changes, which I'll talk about in a second. So this video is me sharing that information with you, as well as some of my ideas on where to go from here with the information. The target audience for this is the higher ups at the hospital that I work at, because I have some suggestions that they could take into consideration, as well as any medical professional who works with the public. So the question that I addressed was, as I said, in regards to CPR. The big problem is that every year more than 350,000 Americans have a cardiac arrest outside of the hospital, and about 90% of them die. Most of that happens before they've even reached a hospital. And this is because CPR isn't started at the scene. Bystanders don't know what they're doing, and they're uncomfortable performing CPR because they're afraid that they're going to do something wrong. So the American Heart Association creates the guidelines for cardiopulmonary resuscitation, and in 2015 they changed it. The previous guidelines suggested 30 compressions at 120 beats per minute, followed by 2 rescue breaths. They changed this to not have rescue breaths at all. So it's just compressions at 120 or 100 to 120 beats per minute. So my question was, in patients who have had CPR, how does hands-only CPR compared with CPR with rescue breaths affect chances of long-term survival within the first year following the out-of-hospital cardiac arrest event? The reason that this is important is because even in trained lay people, there's a lot of discrepancy on how it's performed. Even the best trained people aren't doing it correctly necessarily, and the new guidelines are supposed to make it easier for them to follow. So it also depends on how willing people are to jump in and perform. Most bystanders are going to be nervous that they're going to do something wrong, and they're afraid to jump in, when really CPR immediately is the best thing you can do to help somebody's survival. So some little facts that I found about CPR are, it's really the most important thing in an outcome is perfusion rather than ventilation. We'll also find that there's a lot more studies regarding perfusion than there are ventilation, and that's something that could be addressed in more studies. Less than 1/3 of out-of-hospital cardiac arrest victims even receive CPR. And that's the one thing we can do to help people, and they're not getting it. 75% of these occasions happen in the home. So the people that we're teaching to do CPR, it's not like probably going to happen when you're out and about in public. It's probably going to happen in your home to someone you love. And the best thing you can do for them is to get on the chest and start compressing. I also found that brain death from lack of oxygen starts within 4 minutes and is complete within 10 minutes. So those first 4 minutes are crucial to keep the perfusion going to oxygenate the brain. To research this, I found many articles and took many into consideration, as well as the guidelines on the American Heart Association website. But there were 3 main articles that I focused on because I found the information to be so good. So the first article was based on a study done in Japan that went out to ask the same question as my Picot question. It looked at out-of-hospital cardiac arrests. They focused their study mostly on pediatric patients, but it all focused on bystander CPR. Initially in the study, they found conventional CPR with rescue breaths to have a slight advantage over hands-only CPR. However, they adjusted it for multiple variables that they found, and it was no longer statistically better. Both of them were about even, whether it was hands-only or CPR to include rescue breaths. The main finding that they had in their study was that any CPR is better than no CPR on the scene, and whatever we can do to make that happen faster is important. The second article that I read started because these people found that there was not enough information available on the long-term effects of CPR and the specific type of CPR that people had received. So they went out to try to find some studies and find information to show the different effects between the different types of CPR. They focused on out-of-hospital cardiac arrest, and they focused on dispatcher-instructed CPR. So when someone's called 911 and the dispatcher gave instructions, half of it was dispatchers that gave instructions with rescue breaths, and half of it was without. There were 2 randomized trials in this study, and the total amount of deaths in the study was 2,260 of these people did not survive, and only 236 did. So about like 90% difference between survival rate and those who died. It's huge. They found that compression alone, without the rescue breaths, was consistent with a better long-term survival rate. They suggest that this is because it's easier, and knowing that it's easier to do increases the speed of delivery. The third article that I looked at was prompted. It's a study prompted by the changes in the CPR guidelines as well that happened in 2015. They stated that CPR is the cornerstone in cardiac arrest, and they decided to look at the changes since it's so important. The definition of optimal CPR changes with time, and they wanted to look for evidence and the importance of CPR quality, then debating which quality or which type has a higher quality. So they took this a step further to see how we can use this information to improve clinical outcomes, which is really what I wanted to know anyway. They suggested that the layperson performs best with the most simple instructions, just as the previous study did. It's going to increase the time or decrease the time it takes for the bystander to get on the chest. They found that hands-only CPR is more effective in having high-quality chest compression. It's easier to teach, but they also stated that there need to be more studies about the effects of ventilation in CPR, and they said that high-quality CPR really requires training and monitoring, having people renew their licenses and perform properly. Overall, between the 3 studies, I found kind of the same information. It was that any CPR is better than no CPR. The faster you can get to CPR, the better. It's easier to teach hands-only and easier to tell people over dispatch. Bystanders are more likely to perform hands-only CPR. And it's recommended to improve likelihood of CPR happening rapidly. By performing CPR at the scene, the chances of survival are more than doubled. So what I asked myself then is, how can we increase CPR getting performed at the scene? How can we get this teaching out to the public? And as medical professionals, I feel like we have an obligation to help our community do what they can to better their health. So my recommendations for practice for all medical professionals are, when you're doing discharge teaching at the hospital with a patient that's high risk and the family is there, teach the family about hands-only CPR. It doesn't take very long. Show them the correct placement for chest compressions, and suggest 100 to 120 beats per minute. And there's a couple of songs that work well with that. One of them is Staying Alive. I think most of us know that, and it's a catchy one. Most people will remember it. When you're outside of the hospital and you're a medical professional, respond to the emergencies as trained. They did find that trained professionals in hospital settings do better CPR when they are doing the rescue breaths, because that's what we've been trained to do. So perform them as we've been trained. Encourage patients and community members to learn CPR. Anybody that's in the hospital, you can tell them, this is where you can take these classes. It's good for you to do. It's helping our community. For the people higher up in my hospital, what I suggest is that we start a program, and my pilot plan for this program is called Hands and Hearts Campaign. As healthcare workers, we should all be concerned for the greater good and well-being of everybody that we come across in the community and the health of the general community. I would like to initiate a hospital-taught and sponsored free CPR clinic for the community, something that happens often and something that we market. My goal of this is to increase the number of CPR-trained laypersons in our community, and we would teach this using hands-only CPR. To start this program, we can train some hospital staff members to teach it on a volunteer basis. And and possibly offer something in exchange for community service hours, education credits, something like that. My idea is to go to the community, push it in schools, high schools. Other areas of the country are doing this in middle and high schools, teaching children how to do this. Colleges, workplaces that have a lot of employees, churches, partner with the Parks and Recs department, partner with the cities, partner with the local fire departments to try to get the word out there. Distribute brochures that promote the events. The American Heart Association actually has kiosks you can get that are CPR kiosks. They have them in certain airports. I know the Dallas airport has one. I read about it. And it's just a kiosk where you can perform CPR and then it tests you at the end. It doesn't give you a card, but it tests that you are doing it accurately. I also suggest to call the newspaper, get press support, tell the TV stations what we're doing, push the Hands to Heart campaign. And then use music to help the learners remember. Like I mentioned earlier, 100 to 120 beats per minute. Some songs that are recommended are Stayin' Alive, kind of morbidly, Another One Bites the Dust, Crazy in Love, and Hips Don't Lie. So surely there's something for everyone. So in conclusion, I just want to say thank you for listening to me. Please take what I've said to heart. I hope that I've helped you to see the value in community CPR education, and you know, it could be you that needs somebody to do it on you, so why not try to teach as many people as possible. Please join me in my effort to improve CPR outcome at home in our community. Thank you.